So if you guys haven't already, Bing is to my right, Jared is to my left. I did post pictures of both Bing and Jared on our Facebook page to at least give you somewhat of an orientation. Bing's profile was also provided for those who didn't know or do not know of Bing. Jared to the left. So the first thing I want to ask, Bing, do you remember when we met in Burt's in Palmerton and had a conversation? Do you recall what you had to eat?
Oh man, bagel?
Is that what you had? I don't know. I was asking you the question.
I think so.
Okay, good. Now, Jared, you were here, I think actually shortly before I met with Bing. Do you recall what you ate here?
I know I had coffee.
And what kind of coffee did you have?
You got that sponsorship then.
Right, coincidental.
So,
right.
But no, I know I had a dessert of some sort, but it was a strawberry rhubarb. That's what it was. Yeah.
Oh, very good. All right. No, that's good. I was just curious, wanted to know how good the memories were. No, it was a test. Well, again, thank you both for joining, both Maggie and I here. This is a great pleasure to have you. Bing, I want to tell you, I went through a second and third time the four-part series to listen to some of the audio blogs, a lot. I went through all the pictures and stuff like that. And as I expressed to you, I do have a little bit of background in quote-unquote journalism with Military Review, the professional journal of the U.S. Army, but nothing like you did. It's obvious to me you invested a lot of time in that four-part series. And I want to thank you for, highlighting what, if I recall, you referred to me as a potential healthcare gap here. So I wonder if you could give us a quick synopsis of that four-part series. And the reason I asked the four-part series, because I think, like I mentioned earlier, a lot of folks here in Carbon County only receive the Sunday edition of the Morning Call. So they only saw 25% of what you actually published. And likely they didn't see the other portions that were available online. So if you could give us a synopsis of that entire work that you did and what you were trying to focus on during that.
Yeah, sure. And I wonder if it's helpful to talk about what started the project
Great.
Too. Yeah.
Mm-hmm.
Yeah, so this project was funded in part by a grant from a university. And the grant was to have health reporters explore an area where there's a health gap, right? Mm-hmm. And that could be any kind of community. Mm-hmm. So for me, I thought, well, in rural Pennsylvania, there are a lot of health issues here. Mm-hmm. Hospitals aren't doing well. This is a really good topic for a newspaper, for our newspaper. Mm-hmm. So that's how the project began, and it's in four parts, and it looks at in what areas are where is the health gap in the region north of Allentown? What are the issues? Mm-hmm. Why aren't people getting better? Why are people sicker? Where's the infrastructure? Mm-hmm. So the first part is an overview. You kind of get to know the people who live there. Different, some people
live where, Bing?
Oh, they live in Carbon, different parts of Carbon County. Mm-hmm. Lansford. Yep. Palmerton. And Coaldale. These are just some of the places. Yep.
And Coaldale is just across the border.
It's very close.
Right.
Yes.
Yeah, but.
So it's the overview, and then the second story looks at transportation. So what happens when you don't have a car, but you need to get to your therapist, you need to get to the pharmacy, or you need to get to your primary care doctor, and especially in an area where there aren't many doctors, if you don't have a car, it's not like you could figure out a 5-minute to walk half an hour. It's sort of like you have to put this puzzle together. Not only do I not have a car, but the doctor is like 40 minutes away by car. So we kind of get into what life is like if you're really sick and you don't have a car. But also, it's an inspirational story, I think, the second one. It's what happens when you have parents who will do anything for you. And I don't know if you guys, I know you read the story multiple times. Oh, well, this is the story about Keith.
Yeah, the gentleman. Yeah.
He has retired parents. Yeah. And they've spent their retirement driving him to all the healthcare appointments he needs. And then the third story it's about the drug epidemic. I mean, it's really serious, it's really heavy, and it's about a family that lost their daughter.
Yep.
My age, actually. She was my age, and just like, you know, the desperate need for more treatment options here. And then the last story looks at just the doctor shortage issue. So I focus on 3 main areas: primary care, dental care, and mental health care. So looking at, you know, in comparison to the rest of the state, the ratio of people to doctors really a lot lower here. And it's just, you know, I mean, healthcare at the end of the day is a business, and it's harder to run a business here when you don't have as many people, you know. So we kind of like talk to we talked to one dentist who talks about how, you know, Medicare and Medicaid, they don't reimburse well. So for him to make his business work, you know, he can't take on Medicaid, even though so many people in his community need it. So yeah, so that, I hope I didn't go on too long.
No, that's good. That's a great overview, and it's so important because, like I said, probably a limited number actually got to see the whole 4-part series. And so even Jared and I and Maggie were talking a little bit before you arrived that may have given a slanted view because they didn't have the total context to that. Could you talk to that a little bit, Jared? Maybe what the perceptions were when that first one came out. I believe it was on January 27th. Yeah.
So I talked to Big a little bit about this and kind of say, you know, like, you know, we're not here to debate or anything.
Right.
We're just here to kind of just really bring more information on what kind of help we can get moving forward with something like this. But the initial perception is it kind of sometimes paints, I think, the stereotype when you can kind of say, like, I could find like the individuals that have each one of these gaps are barriers to their ultimate treatment along the way. So I think sometimes, like, when it was first worded, it seemed like, okay, it was like almost like exploitative as a result of this. But at the same time, when you really pick it apart, everything that was stated there is a gap. Like, maybe not one person has all 5 or 6 of those same gaps, but is there a majority of people that definitely have 2 or 3? I've been working social services in this county for the last 10 years. I can 100% say yes to all that. So I think there was a need that, even though it came across that way initially, that we still need to really understand the reality of what this is. And this is something that really can't continue to be ignored. Otherwise, it will be continuing to be wider gaps and only more struggles.
Bing, did you speak to any of the elected officials in any of the communities prior to publication?
Yeah, I spoke. Oh God, you're taxing my memory.
No. So how about just the town, or you can mention the borough or town?
No,
not a specific name.
I don't remember. You know, he might have actually been in the story.
Okay,
but yeah, I spoke to someone who is an elected official in Carbon County.
Yeah.
So do you guys call them as a supervisor?
Right. That would be
one of the supervisors.
Could be a supervisor.
Yeah, to talk about some of the health issues.
Right.
I think we talked a lot about drug court.
Right.
Yeah.
And we have a drug court now. We set up a
veterans court
also.
too. We talked about veterans court, and actually, he and, you know, because I had so many interviews that I wish I could have written 8 stories. And one of the stories he told me was for veterans court, the transportation they have, it's like a rented car that belongs to maybe a travel agency that's funded entirely by donations. So I thought that was a really interesting.
They have volunteer drivers.
And volunteers, so it's just sort of like, you know, if I had more space, I think that's a really interesting story about, you know, there's not too much money for a program like that. So people are just working with donations.
Right.
So yeah, since you asked about elected officials, I remember that conversation.
So reach that.
Yeah.
So Jared, what was the response that you saw? Did people look beyond the fact that Lansford was being highlighted in that first edition and say, like, you recognize that, you know, this is all based in facts? Well, unfortunately, it's looking at Lansford, but indeed it is reality, or people's emotions probably overrode them sitting back and looking at it maybe a little more objectively.
I think you hit it right on the head. I think even though maybe these are some of the areas or the resources that maybe we lack, what we do have a lot of is pride. You know,
right?
And I think that's what's going to hit people initially, and in any kind of case, behaviorally, until you really kind of look at more of the facts and really kind of process those kind of things more. So I think, initially it's going to be taken like that because we do have many volunteer organizations and people that do work hard in our area. So I think when they kind of feel that way, they kind of feel like that's kind of like a slight in that kind of way. But I think the more that we have had the opportunity to talk about these kind of things, the way I kind of look at it is like now there's an avenue, there's an opening, so at the same time we have an area that's really kind of tucked in, we often are forgotten, so can we use this to our advantage in some sort of way, like with this kind of opening, what can this piggyback into? So I think that's where we just have to kind of take a situation where this is the reality of this, but like where now this is the reality of it, what do we kind of do with it? And that's what I feel that our community is about, because through the organizations that we have and people that are volunteering, people do want to see the best for our town, no matter what the challenges are.
So I was going to just really comment quick on that. It could be even like a call to arms, where the pride of Lansford comes out and says, "Hey, they can't talk about us like that. We're going to do something about this, and we're going to," you know what I mean?
A call to action.
Call to action.
Yeah. No. Right.
Call to arms.
Yeah. Same. No.
Not to arms. Like
pugilistic. Right? Thank you.
I'm definitely interested in hearing more about the productive conversations that you've been able to have after the article's been out. I'm very curious about them.
Yeah, absolutely. We can definitely talk more about that. Absolutely. But yeah, I think that's just what it is. I think just anything's going to hit people like that. But yeah, you can't, like I said before, you really can't ignore those kind of things. These things are real. They're here. I've worked with people that have gone through these kind of things. So it's just so they're out there, and and these barriers to treatment, just as people kind of behind after a while when you don't have that other support, like you guys mentioned, whether it's through family or friends, you don't have the resources to kind of get you to these things that are ultimately going to help you then too. So, and the way I kind of looked at it, like especially with the drug use part, that's often your support network is often the first thing to strip and to resolve that because of the actions that many people go through. So I think it's only natural that people struggle that much more when they are trying to get help, because they're really just trying to piece together who is here that I can rely on at this point then too. So not every situation is the same, but there's kind of certain themes to many of them.
Being as you were receiving comments on your articles, did you note that as you got further away, or those comments got further away from the epicenter, the area that was highlighted, there was a change in attitude of the perception? Like I would say, folks from Lansford might have had a really, really distinct, unique perspective and commentary, whereas you got down to maybe the Lehigh Valley, even though I understand, families all across our state and county and the country are impacted by this, but was there any sense of a change of maybe sensitivity, sympathy, empathy to the issues as you got further away from Lansford, from Summit Hill, from Palmerton?
Yeah, I definitely recognize that what Jared was saying, that people are proud. This is where they live. This is where they've chosen to build a home. And as much as I can say, as much as I try to explain, it's a health story. It's about a health gap. It's not meant to be a profile of the town. You can't help it but read it as such if you're so intimately connected to the place, right? So I get that. But we did have a mix of responses from people who lived in Lansford and Coaldale and other parts of Carbon, or even Schuylkill. There are people who reacted the way you did, but there are also people who really felt like, wow, this is my experience. Like, this is my life. Like, I don't have trouble getting to places. I have trouble paying for these basic things. Like, I know... this resonates with me. Or there are people who say, yeah, I see this. Or they may be volunteers, or they might work in social work, or and they see this every day, so they also really feel like it really resonated with them. And as you said, I think the farther away you got, people definitely took it less personally. They lived in Lehigh Valley, or if they had lived in Carbon but had moved, or Schuylkill and had moved away, it was just.
Because if I recall from your numbers, it was 23 deaths in Carbon and Schuylkill. So we're kind of the rate of deaths associated with it were both 23, Schuylkill and Carbon. Do you recall that number?
That number, I believe, was actually, I think that's Carbon's 2016 opioid, 2016 drug-related death number.
Right, and I think, it matched Schuylkill's up there also. I thought those were the two counties that were tied on it. What else did you see from the statistics, from the data side, that kind of surprised you, or maybe reinforced what you were looking at, saying, yeah, there's a problem. You have an elderly, you have let's say a graying tsunami of gray. The number of the ratio of doctors to individuals in the community.
Yeah.
Yep.
I still remember the statistics pretty well.
Yeah.
I mean, I can't get to the decimal points
right,
at this point.
No, right.
But yeah, I remember being really surprised. It was like, compared to the rest of the state, there were half as many primary care doctors.
Right,
and we're talking about not absolute numbers, but in comparison how many people live there, there were half as many, and was half as many dentists, and 1/4 as many mental health providers, which really struck me because mental health is a tough thing to talk about because we're still at a point where I think not everybody recognizes it as serious as physical, even though, if you're in the middle of a mental health crisis, it feels just as real as a physical crisis. And, you see that there aren't many mental health providers here. And then you also see that suicide is a big issue here.
Right, yeah.
So, I'm not, I don't know if there's a team of researchers who can draw a clear line between the two, but I mean, they are definitely related.
Right.
So
there's at least associations, not causation, but definitely associations.
So that definitely struck with me. And then there are the physical stuff too. It's an older population. Some of the chronic diseases that people are familiar with, they're higher rates here.
Yeah. Jared, what is taking place? I understand from Bing's article and then running around Lansford a little bit, it looked like, was it LVHN or was it St. Luke's is putting up a facility? Is that complete yet? Or?
Yeah, next Wednesday on March 13th from 5 to 6:30, and we would welcome anybody to attend. You would just have to contact St. Luke's. But they're doing an open house at the new medical facility that St. Luke's has built in town. You mentioned Mr. Bennett before, so he was the developer of that project too. So, we're looking forward to adding another facility, especially with having that kind of national recognition with it too. I think it's going to be a great benefit to our community.
Are you familiar with the type of services that they're planning at that facility?
I at least know right now it's supposed to be just general primary care, and I think there might be some physical therapy, but I'm not definite on that. So, no, I'm not too familiar yet.
And the reason I say that, because then it doesn't necessarily impact the gap or help fill the gap as much as we'd like, because you talked about the lack of mental health.
Yeah.
So now it's going to work on the primary care, which is important, but you saw a big gap in the mental health? Is that correct?
There's a big gap in availability of mental health providers. When I talked to St. Luke's, they did have a plan to have a counselor there.
Okay.
So, but of course, the need is bigger than one counselor in Lansford. But I do think for people who live there, that will be a benefit.
Is there something, looking back, you would have focused on differently, or is there another area in regards to the health gap other than transportation, number of doctors, number of counselors, that you would have looked at, or something you saw in hindsight that you wish you would have dug deeper into, be it in Lansford, Summit Hill, Coaldale, Pownard,
Yeah, that's interesting. It's an interesting question because as a reporter, you always wish you could go back and do something differently. That may even be true for any project, right? You're like, oh God, I wish I could have learned more about this or that. And I guess, and I don't know if there was a magic solution, but I think what was really frustrating for me doing the story is I felt like I couldn't point to, well, this is clearly the path forward. Like, this is the solution.
Right.
And I've had discussions and I've asked people, but I never hit that moment where I'm like, oh, this is clearly the path forward. And I guess I'm also curious to hear what you guys have to say, like, solution-wise, like, what needs to be done right away. I never got that piece of when I was reporting. I mean, there were pieces that were helpful, like St. Luke's building, that clinic in Lansford seemed to be a solution to the fact that I was talking to a couple that really didn't have a local doctor that they could go to, and with the Veterans Court was also part. That's a solution, and drug court for helping people with drug addiction. And I know that the Carbon County's drug and alcohol administration they were getting more money, so that's helpful.
Right.
But it's just compared to the scope of the problem was just so big.
And multifaceted.
Yeah, exactly. So I guess I definitely would have been more interested in learning. Well, what are the other pieces to the solution?
Right, and I think that's extremely challenging to come up with a solution because again, we know if we look at opioid, people are going to talk about big pharma, right? They're going to talk about doctors overprescribing. Then you're going to talk about people who are using it improperly, but do not a lot of these problems go back? Again, those are symptoms of something bigger. Does it come back to the core issue of society where we are today, that there has been a disintegration of the family unit? And so as the family has changed and evolved, some would argue for worse versus the better. We have families that aren't the center of our communities anymore. That has added to the problem or the potential for individuals to go into become associated with other individuals, or potentially to maybe stray away from a path that would keep them away from this type of things that lead them into these situations. I mean, is the family unit back where we need to be focusing on? Because we continue to apply Band-Aids onto the symptoms. So really, what's the core problem? Is it the disintegration of the family? Is it our drug laws? Is it our court system? I think it goes back to the genesis of the family. But politically, that's a multi-generational decade problem that can't be solved. So as a politician, would someone try to apply resources to fix the family, or are you going to have all these short-term, we spent $8.5 million doing X, Y, and Z, and not necessarily achieving something?
Well, another thing I see too is there's not much volunteerism in Carbon County, as far as I'm concerned. Like, I think there could be more. I always think there could be more volunteers, more people that are willing to go out. Like, I was potentially thinking about becoming a driver for the Veterans Corps, but it's hard to fit into your schedule. They don't make it easy for volunteers to volunteer. But I don't like it seems like there's like the volunteers that I'm around, because I volunteer in different areas. They're usually older. There's not anyone I know there's people that are at home when their kids are at school that maybe don't work, that could volunteer during the day, and they don't.
Is Cindy online?
Cindy, no, I did not see her come on. So
because I know Cindy and Marianne have some pretty good perspective. Cindy Lacisco has some great perspective on this. I was hoping she would.
I did send her an invite, but she didn't.
Okay. Jared, so Bing was asking, again, I think this is a very challenging and perplexing problem. Maggie talked about it being multifaceted. From Lansford, from an elected government official, how is Lansford attacking the problem?
Yeah, I think a lot of our basis is really just trying to figure out how to the thing that stands out is our tax base. So that's the kind of thing we feel that we have to just address in whatever way that we can, whether it's allowing things like St. Luke's to come in, or creating opportunities like that our community is more welcoming for certain businesses. Because of its isolation, it is very difficult for businesses to survive. So I think that's another element that kind of factors into it, almost just how the healthcare needs businesses, because people support their businesses too. So I think that's where we're just, at least initially, we're just trying to figure out what we could do to be most efficient on our administration of things, and hopefully that those things kind of trickle down to the improvements that we hope to make kind of overall. Okay. But yeah, that's kind of just where we're at. Counselor?
I'm curious to know how many people from Lansford are being hired to work in that facility. Just off the...
Well, I would say the challenge is, obviously, do people in Lansford who are currently there have the training and education for those types of jobs? It's just like, St. Luke's is building a major facility in Franklin Township. Now, at the same time, though, obviously the Palmerton Hospital and Gannett Hutton are basically disappearing. They may become little centers of excellence for some type of care. But the fact is, where the majority of those workers going to come from for the new hospital? Well, we know it's going to happen. And the Morning Call just reported it again last week. It's that daily migration. Actually, more workers leave the Lehigh Valley to work outside of the Lehigh Valley than actually go into the Lehigh Valley. And so I see this large influx of highly qualified individuals coming off the Turnpike interchange at Mahoning Valley.
When all of our people are going to
Lehigh Valley. But again, it's different qualifications, right? Lehigh Valley is truly a center of medical excellence, and so that's where the trained professionals are. In order for St. Luke to meet that in the short term, they're going to be coming from the Lehigh Valley. Now again, we have Carbon Career and Technical Institute right here that does have a nursing program. I can't remember at what level they come out certified, but there is a program. So so how does St. Luke's, and I do know they have initiatives to work with things like CCTI and ensure that we're developing, breeding our own medical professionals to meet the needs of our own community, and not necessarily exporting those jobs to the folks in the Lehigh Valley. And it's, I think, an extremely a big challenge we have here in Carbon County, and I'm concerned with that. I think we're going to have a net loss of jobs for Carbon County residents as Palmerton and Gunutta Hutton continue through the transition and the acquisition process takes place. And again, but hopefully in the medium to long term, that'll reverse. But in the short term, I think we're going to see a negative net loss of jobs.
Well, it's just it's interesting because I'm hearing Jared talk about tax base and bringing in businesses and supporting businesses that might be having trouble locally. And it doesn't sound like a health issue, a tax base, but it's all related. I mean,
economics is
talk about
right. Yeah.
I know people don't necessarily feel a lot of empathy for someone who's recovering from a life of from drug addiction, but at the end of the day, like, getting better does involve like finding a way, finding a job. And right.
Community to improve their life and continue to stay away from drugs and all that. That's all part of their self-esteem is wrapped up in whether they're earning money and
also being in the community where they feel like they can build something there. It is all intertwined.
It's a sense of meaning and purpose. I think that's what I also got. Is just say, like, whether it's a job, volunteering, you're engaged in something outside of yourself that like brings out more of those kind of traits in you, in that kind of way.
And that goes to volunteerism too. That when you're helping other people, you're not focused on your own issues and your circumstances and all that. You're helping other people, and it gives you that feeling of like, wow, I did something good today, And that's why we talk about the wind turbines too, like how it affects Lansford. You think, well, because they get to look at it. Well, no, because that reduces the property value, and then that raises the
millage rates. The need for the millage rates go up.
And then the people who are on the edge of poverty or on the edge of not being able to afford, when that millage goes up, then they lose their homes, then they're homeless or they're foreclosures. There's a lot of it all snowballs.
Ties in. So that's, I'd like to we're going to finish up here in just a minute or two, but if there are any questions from out there on the chat line, I'd love to have Bing or Jared address those.
Marianne said Cindy is on. Okay.
She's an expert in this area. She truly is.
And Christian was saying Palmerton Hospital is going to be converted to an urgent care in the coming months, as he's heard. And Lehighton is likely going to be adding ER rooms to meet the increased demand. But and Cindy hasn't commented on what we've been talking about.
Yeah, so we're just going to finish up here in about 2 minutes. So if you do have any questions for Bing or Jarrett, I would ask you get them in here quickly so they can address them before we finish up here. Bing, is there anything, are there any plans for a follow-up some point down the road? Because now you've identified the gaps. And again, Maggie spoke to a call to action, right? Because we want to try to create change, a call to action. So is there any thought in your mind, a year from now, come back, re-examine maybe some aspects of this to see if there is a change, or 2 years, 4 years? I mean, I don't know.
Yeah, I had talked with Terry Purcell, and I just had to remember he doesn't say Purcell, he says Purcell. He had been the president of Nathan Hutton and Palmerton. Now he's at LVHN, and he's in charge of their rural growth strategy. And I just, talked about some of the issues that resonated with readers after the series, and asked him about, what LVHN's plans are. Because, these large health systems, they are adopting more of a comprehensive health strategy. So it's not just about, the care at the hospital, but like, how are you going to get your patients to their doctors if they don't have a car? So we did have a conversation there, and I think that's the start of figuring out. I think they have some programs to announce down the road. Nurse practitioners. I think that's a really interesting follow-up. But one of the things we heard from our readers is, well, it's hard to recruit doctors to come to these areas.
Right.
It's just doctors are trained in cities, Philadelphia or New York, and a lot of time end up going to cities. The big question is, should nurse practitioners take on more responsibilities so they can fill these gaps, which I think is an interesting follow-up story. So that's something that I'll be working on the following week.
Well, that's great. And I love that you mentioned that, because then we assessed a hospital program during my MBA studies, and this was an actual study we did. So, nurse practitioners, RNs, LPNs, how many of them can you get for the cost of one doctor? So it's a force multiplier. So you might be able to get 3 RNs for one doctor, or 2. So again, as long as you can get them the skill set that they need to maybe address more of the issues that a doctor would have. Again, it can be an effective way of getting more bang. Physician's assistant's another, right? You get more bang for your buck. So you don't need 20 doctors, but maybe you can get 40 registered nurses, LPNs, or PAs, or whatever the case may be. And again, that's kind of looking at it from an economic model also. But I always wonder, hospitals, even quote unquote nonprofit hospitals, they're in the business of making money, right? The reason they exist is to make money. And so that creates, I think, a challenge for them, because they're providing a needed service, but at the end of the day, they still have to make money. So you made a perfect example with the dentist. Medicaid and Medicare isn't providing sufficient for them to want to cover those individuals. We have a special needs daughter who receives a state support for her medical, but I know certain doctors will not take her medical. If it wasn't for us to having a secondary insurance, her needs would be challenged, because of simply, again, they just pay too low, and certain doctors and dentists won't accept it. As a matter of fact, Molly's dentist doesn't accept the state provided care that she's. So again, I see that problem. Well, I want to thank Bing and Jarrett so much for joining us this evening.
Christian said the state needs to allow nurse practitioners to function independent of physicians. Other states allow this. And Jane said, I believe that various social areas that have deteriorated have certainly contributed to the current breakdowns. I believe that the local churches can be utilized to inspire a return to a healthy lifestyle. BMCC has a prison ministry to support and assist in reintegration into the community. CR, which is Celebrate Recovery, that offers support with various hurts, habits, and hang-ups, and addictions, recovering from addictions and all that, and children's and teen programs. If the school sporting programs would schedule the various sports activities after 11 a.m., that would enable families to attend churches and strengthen the family unit.
There you go. Well, thank you for resonating that final point. I remember growing up knee-high football. I think we started at 1 o'clock, and I know if I was not in church on Sunday morning, on Monday, Mother Superior would be, hammering at us. They're at Immaculate Conception. So I don't know how they get away with it today, you know, at least in things like Marian and stuff like that, and the few remaining Catholic schools or church-based schools that we have here. Again, thank you so much. So this is Chris Lukasevich for Carbon Matters live streaming. Again, I thank both Bing and Jarrett for joining us. Look forward to seeing you again in about 2 weeks from today. And about a week prior, I'll let you know who our guests will be for that edition of Carbon Matters, the live streaming edition. Thank you all so much. Have a wonderful evening, and my apologies for kind of going over by about 7 or 8 minutes. Have a great evening. Bye-bye. Thank you. Yeah, I got it. Yep. Good. And?